Davis with PAR. Welcome to the March 16th edition of PAR Tuesday News Review, your timely source of news that is important to IDA providers in our community. March is Developmental Disability Awareness Month, a time to raise awareness about the inclusion of people with developmental disabilities in all areas of community life, as well as awareness to the barriers that people with disabilities still sometimes face in connecting to the communities in which they live. A recent study published in the National Health Statistics Report examined the prevalence of children aged 3 to 17 years with developmental disabilities by urbanicity in the United States between 2015 and 2018. The study's authors, Zablotsky and Black, found that children living in rural areas were more likely to be diagnosed with a developmental disability than children living in urban areas, 19.8% compared to 17.4%. Specifically, children living in rural areas were more likely than urban areas to be diagnosed with ADHD, 11.4% compared with 9.2%, and to be diagnosed with cerebral palsy, more than twice the rate, 0.5% in rural areas compared with 0.2% in urban areas. However, among children with developmental disabilities, those living in rural areas were significantly less likely to have seen a mental health professional, therapist, had a well-child checkup visit in the past year, or to receive special education or early intervention services compared with those living in urban areas. As the Pennsylvania legislature discusses the Pennsylvania state budget, PAR is actively lobbying for the interests of people at IDA and providers who support them. PAR's COVID-19 relief request is for $540 million in COVID-19 relief for IDA providers. This relief would be used for costs associated with returning programs that were previously suspended, continued PPE costs, and constant challenge of hiring and retaining an adequate workforce. IDA providers need COVID relief funding, and we need it now. PAR put out a request yesterday encouraging everyone to send as many emails as possible to Governor Wolf this week. Please visit PAR's website or Facebook page and take a minute to send a personalized email to Governor Wolf now. Our budget priority requests outside of COVID relief are $13.484 million to move 832 individuals off the emergency waiting list to the community living waiver and consolidated waiver, increasing EI provider rates, and $500,000 for analysis to refresh the data for IDA rates that are required in regulation. The next federal COVID-19 relief package, the American Rescue Plan Act of 2021, is now law and is in the process of implementation. PAR is waiting for federal guidance on the sections that impact our members. Meanwhile, please continue to share the message with Governor Wolf's office and state legislators that providers are struggling with dealing with COVID-19. Governor Wolf announced last week that all people in Priority 1A should have their vaccination scheduled by March 31st. Although this is welcome news, changes need to be made to the Commonwealth's vaccination prioritization policy. Last week, PAR joined other advocates in strongly asking that Pennsylvania allocate vaccines specifically for individuals with IDD and their caregivers, similar to the initiative in vaccinating teachers and school workers. We are hopeful that this change in policy will be made soon. As PAR members know, at the beginning of December of last year, PAR asked the governor to prioritize people with IDA, DSPs, and other staff having direct contact with people with IDA and family caregivers as Phase 1A priorities for vaccine distribution. At the time, PAR cited 3 studies that found a higher mortality rate for people with IDA. Now that a 4th study has found the same, we are hopeful that the governor will move to change Pennsylvania's vaccination prioritization policy. Thanks for tuning in to PAR TNR. Stay safe, everyone, and we'll see you next week.